I'm just wondering where the chair is.
Alison, I take it we're still waiting for Dave?
Yes, yes. He doesn't seem to have logged in yet.
Let me get my phone, which I've got on charge. I'll give you a quick,
He's just logged in, so I will take the screen off. I think we can start the meeting.
Afternoon, Alison.
Hello, Dave.
Thank you. Just checking my mic was working, so thank you. Good afternoon. I make it 12:30, so welcome to this meeting of Bedford Borough Health and Wellbeing Board. Item 1 on the agenda is questions for members of the board, members of the council, or members of the public. Have we any notified questions, Alison?
We have received no questions, Chair.
Thank you very much. Are there any questions for any members of the board or council who are on the line? I think there are only board members. I take silence as no. Item 2 is apologies for absence, and I have received apologies from Councillor Jackson for this meeting. Are there any other apologies?
No additional apologies.
Okay, give anybody else a chance. In which case, we'll move on to item 3. To confirm the minutes of the special meeting of the board held on the 28th October 2020. Are they agreed?
Agreed.
Thank you. I see some people saying agreed. I hope it's agreed. It looked like agreed rather than disagreed on mute, but plus Wendy and Ashok's putting his hand up, which I'm assuming is meaning yes. So thank you very much for that. Item 4 is disclosure of local and or disclosure of pecuniary interests. Members are reminded that where they have a local and or disclosure of pecuniary interest in any business of the council to be considered at this meeting, they must disclose the existence and nature of that interest at the commencement of that consideration or when the interest become apparent in accordance with the council's code of conduct. Do any members have such interests? No. Thank you very much. So we then move on to item 5. which is progress against joint health and wellbeing strategies 2018 to 2023. And the first item that is the Child Health and Wellbeing Officer Group, and item A, to receive a report on the progress against the strategic objectives, which has been circulated with the minute pack. Over to Ian.
Thank you, Mr. Mayor. I'm conscious we have a very full agenda today, so I'm going to keep this short and sweet. You have the paper in front of you. We have 3 areas of focus in our strategy for children and young people. First of all, thriving families, and in the report there we summarise some of the work that's been done by ourselves and our partners over the course of the COVID-19 pandemic to mitigate the impacts of that on our most vulnerable young people. In terms of priority 2, which is good health and well-being, we've continued to provide an advice and support to families to help them to eat well and be active and remain active at these really challenging times. And partners such as the YMCA have been supporting families who are struggling with schemes, including the Community Larder scheme. From a health perspective, over the last period, we've had the Community Children's Nursing Team, which is now operating 7 days a week. And we also have a rapid response service in North Bedfordshire, which enables families to book appointments directly from 111, which avoids unnecessary A&E attendance. And our schools team are supporting the rollout now of the Wellbeing for Education Return programme, which is making sure that our education settings are equipped to support children and young people's mental health and signposting to services where necessary. In terms of our third priority, achieving high achievement and aspirations, our schools team, our public health team, we've been working with all of our schools in the borough, be that maintained, our academy trusts and our independent schools, to ensure that wherever possible, children are remaining in school and receiving education, because we know that the benefits of that outweigh the risks of COVID-19 to young people. Where it has been necessary to educate young people at home, our early help and schools team have been supporting schools to both develop their online teaching, but also make sure that we've got laptops available to our most vulnerable students as well, so that everyone can benefit from that. That's my update, but I'm very happy to take questions on any of the content of the report.
Thank you very much. Are there any questions? I can't see any hands. There's James, Councillor Valentine.
Yeah, thank you, Dave. I've got a question for you, Ian. Before I ask a question, can I just say, record my thanks to you and all the public health team for the work you're doing in schools. I think it's just been absolutely first class, the work you're doing together with the education team. It's not easy at all what you've been having to do, and I just think it's commendable. So thank you for that. But I just wanted to refer to the experience of the children in lockdown. On the report, it says there'll undoubtedly be catch-up required for children. And at the moment, none of this the promised catch-up has actually been delivered. And teachers do report widespread anxiety among children, about falling behind. So it's just a bit of an open question, really, for the board. What more can we do to address children and young people's anxiety?
Ian, I think that's a very big question. We've got Martin Purbeck on the line as well, and I think we may wish to come back as a substantive item and looking at some of the head teachers and some of the schools that have got some processes in place. But I think, James, it may be a substantive item we'd like to come back to. I think it's really important. You're quite right. We're seeing some schools sending people home with the 14 days isolation. They're breaking up for Christmas already. And I know that we're expecting a report, executive members of the council, about the blended learning that's happening in some schools and some good examples and where we can improve that. But I think we all share your concern there, James, that we need to make sure that there is the catch-up, but also the inequalities division is not even greater, and those that are that have some of the poorest attainment and some of the most challenges aren't affected unduly. Martin or Ian, do you want to come back? Martin's come off his onto his video, so that probably means he wants to speak. So Martin, and then Ian, if you come back after that.
Well, yeah, just showing that. I think the team doing all of the virtual learning that's available to your children that have been sent home, and there's some real evidence of really good practice, and there's some evidence of areas where things could be done better, as you know, Dave. And we're going to share the learning of what's working well with the schools that haven't been able to have such an impact, and we'll continue to have conversations with those that aren't able to do it as well as others. So it is a piece of work that's going on, James, but I agree the emotional impact on young people is significant, certainly as you go up into the secondary schools and people approaching their exams. I think their anxieties are much, much higher. And as Ian said, schools are generally, I think, working extremely well with public health to make sure children are safe. But there are these other issues that the sort of the longer term issues and the more subtle issues, if you like, which aren't so easy to quantify.
Thank you. I would add as well, though I think we need to accept that we've probably got to manage similar situation for the next 2 terms as well, and so we've got to balance that, and we've got to think about exams as well, and obviously we will find out more about what the plans are for exams over the summer, hopefully, but I think we need to bear in mind that particularly for those students who are expecting to sit exams in the summer, this is going to be a really, really challenging time, and they're going to need a lot of emotional support as well as educational support.
Thank you for that. I know that the council, we have sometime in the spring, I believe it is, the attainments from last year, which will be a strange report because, of course, it was not exams. So we'll probably do it in the council's executive meeting, but I think it should come back here. I noticed that Felicity came onto video briefly and reminded me, one, that she may wish to speak, but also we have some new members from ICS CCG. So I'm pretty certain it's Felicity's first meeting of the Health and Wellbeing Board this time round. You may have turned up in a very early one in a different incarnation. So welcome, Felicity. And it may be Nikki Polanes, but I think you may have been here before, and maybe Reema's, but again, you may be here, but welcome. And if it's the first time you speak, if you just want to say who you are, that would be great. But for all of us on the screen, we've got your names. So I don't think then I need to actually do an introduction. Did you want to add anything, Felicity, to this?
No, just thanks for the invite. It was tricky getting in. Tech didn't want to play, but I've got it on my iPad, so it's good to see you all.
Thank you very much, Felicity. Sorry, do you want to say you are?
I am the ICS executive lead for the local ICS.
Thank you very much. Okay, are there any other questions, James, or comment?
Sorry, I realise it's a full agenda, Dave, but could I ask another quick question? And it's just with regards to internet safety. The internet's changing the whole time, and it's just whether we can reflect on what we're doing in terms of guidance to schools as technology is changing. I'm thinking in particular of the widespread use of applications like WhatsApp among children and young people, sometimes quite young children. And these sorts of applications use end-to-end encryption, as highlighted by the recent Children's Commissioner's report. And this leads to problems with, if there are instances of child abuse, then it's extremely difficult for the authorities to follow up and prosecute. And again, it's just to remind people that we need to keep working on this. As technology moves on, and whether there are any comments on that.
And obviously, it's not just child abuse, but there's also some can be cyberbullying within WhatsApp, which is
and bullying. Absolutely, yeah.
Indeed. I think this is a substantive item we need to come back to, and would be interested to know whether health colleagues think it would be useful about the catch-up, whether it would be useful to have an item coming back to this board just about catch-up of students after what will be a year of very disrupted learning. I'm hoping you'd agree that we can come back and report and look at what we can do. I also think that for my health colleagues, particularly there is likely to be an increase in the number of mental health instances and children seeking support for all kinds of mental health stresses and strains and illnesses. I think we've already seen some evidence for that, but I think that would have to be built into the new report back. Is that acceptable? I want to take silence as agreement.
I think it's absolutely right, Dave. We know that educational attainment is a big marker of how people's ultimate health status in their lives turns out.
Yeah. Okay. So we will come back, and I think it may be more than 1 year, because just in terms of the road to recovery for the economy and for our general health as a borough, I think it's important. So, James, and we'll include within that at least an offline about the guidance, so we can all make sure we share it, because I think there is national guidance about some of the social media and cybersecurity. Okay. Which is probably why Felicity had a great deal of difficulty getting into this, because we're very worried about people hacking into meetings. I'd love there to be thousands of people hacking into Watch Health and Wellbeing Board. I don't see a big problem with that, but oh, wouldn't it be nice? If there are no other questions, can we note Ian's report for 5A?
Noted.
Agreed. Yes.
Thank you. And can we just move on to 5B to receive an update on the progress on the recommendations of child and young people's mental health needs assessment? And it's either Ian or TBC, but I suspect it's Ian.
Yes, it's TBC is busy, so it's me again. So this was a piece of work that was done 18 months ago to understand the mental health and wellbeing needs of our local children and young people, and to map the services that are already in place to support them and the interventions that are in place. And the report, which came to us, had 12 recommendations. That included recommendations to improve access to information and advice for young people and their families, to support a whole school approach to improving mental well-being, and also to improving people's access to and experience of child and adolescent mental health services in the broadest sense as well, to make sure that our children and young people were getting the right advice, support and care at every stage of their mental health journey. This report does set out progress against all those areas of recommendation. Clearly, COVID-19 has further exacerbated the need to better support young people's mental health. So everything in here remains possibly even more relevant than prior to the pandemic. But I think it's, from my perspective, this is a partnership effort, and it's positive to see the progress from across the system, actually, despite all of the competing pressures that we've had over the last 9-10 months or so.
Thank you very much. Any questions or comments? Can I know that Councillor Jackson will be really upset to miss it, and she just couldn't make the meeting. It's for personal circumstances, which I know about and are fully understandable. But she, I'm sure, would speak at much greater length to me and with more knowledge than I do in this. But it's good to see the report coming back. As Ian said, that we probably haven't been able to move as fast as COVID-19, but it's good to see progress on so many fronts. And I know that we'll continue to have it high on our agenda. So thank you for the progress that's been made so far. Any other comments? Ashok? You're on mute, so you're probably saying something meaningful and very deep and thoughtful, Ashok. I think you're now off mute, maybe.
Oh, am I?
Yes, you are.
Oh, thank you very much. Sorry. Already you have covered slightly this question, but my concern really is the concern related to self-harm and effects of that on children. So perhaps a much more rapid progress need to be made in this area, particularly due to the COVID situation. Thank you.
Thanks, Ashok. I would agree completely that particularly when you have children out of school for significant periods, there is much more opportunity for hidden harms, of which self-harm is certainly one of those. we have through this, through this work and through the ongoing work of service improvement, we have a really strong local offer and this and strong and early support for people, and we've put together a compendium of resources as well for families, wider than self-harm but encompassing self-harm as well. So hopefully that families feel empowered and enabled to support their children when they're going through that experience, and understand that and support them in the most effective ways that we can. I don't know if there's anything Martin wanted to add on that.
Yeah, I was just going to say that the hidden harm is something that we're very much aware of. I want to reassure board members that even through the first lockdown and certainly through the second, we only noticed 1 month of significantly reduced contacts coming in the front door where people were concerned about children. And that was the first month. And from there on, they rose up to fairly normal levels. And then when schools returned, we had the highest level of contacts that we've had for some time. But we've had we have had a steady and normal business as usual levels of people reporting concerns. So it reassured me that people weren't just relying on schools reporting those concerns, that where children are at home, people are still getting information to us where children need help and support.
Thank you for that. But we need to make sure we keep those, make clear the lines where people want to report. I know we're doing work on that and have done during the lockdowns about how people can report concerns.
Absolutely. Yeah.
Thank you very much. Any other questions or comments? Kate?
Sorry, just really the 10-year fact there before, the signs first start appearing 10 years before, they accumulate into action. It's quite a stark reminder. And I was just wondering, and I know lots of the good work that is going on and does continue, I'm just wondering around the level of awareness and the stigma that I know still is attached to, young people and mental health. I'm just wondering how, and it's good that parents are more empowered now. I'm just wondering how wide, that awareness is in terms of the early signs of difficulties with younger people, to try and link in with that early help and prevention agenda. I'm just wondering how far that's gone really, and has the lockdown, or will the lockdown cause more of this in terms of the missing, I guess, the gaps?
So I think one thing to note is that clearly the circumstances that we've all been living through, a natural response to that is to feel anxious and sometimes overwhelmed. People will struggle to sleep at times, and so there will be more of that about for all of us, children, young people, adults as well, and that's a normal reaction to difficult circumstances that we find ourselves in. So not necessarily indicative of a mental health issue underlying, but obviously that will also exacerbate people's mental health issues where they're already present. So I think a general awareness in the population, for people to look out for those signs and symptoms in themselves, and to think about the 5 ways to well-being as well, and how we can look after ourselves and those around us, I think is really, really important. We've certainly done some work in terms of adult mental well-being that's been promoted through our well-being pages on the Bedford Borough website and other channels as well. And I think it's probably worth revisiting that to see whether we've had sufficient focus on children and young people. I mean, one thing that we have been promoting throughout the pandemic, and we've actually extended the amount of capacity of, is our COOTH service, the counselling online for young people, which provides not only access to counsellors but also to peer support as well, and forums where people can share their concerns and their feelings, and hopefully ways to recover.
Thank you. No, I appreciate there's a lot going on. It's just that query around if because there's so much going on, and there is lots of activity with regards to COVID, could we be missing, it's just about everyone being really alert to the fact that some things might be what everybody else has experienced, but some things might be a little bit more, and how do we get to
I agree, it's masking potentially, isn't it? Yes, absolutely.
Thank you.
Thanks very much. Are there any other questions or comments? Can we note the report?
Noted.
Agreed.
Thank you very much. Unless anybody says anything contrary, we will move on. So thank you for the report, and thank you for all the work that's gone on that. I am sure that we will want to come back to this in the maximum time of the year. But I think some of the recovery plan in terms of mental health, or some of the work on mental health and young people needs to come back here. Moving on to item 6, Healthy People, Healthy Places Officer Group, and receive a report on the progress against the strategic objectives. Over to David.
Thank you. I'll just give some key points from the officer group meeting held on the 12th of October, and they relate, and as they relate to the report you have before you. So we very much focused on what is the engagement activity directly relating to COVID-19, and then a lot of the discussion actually follows the conversation you've just been having around mental health, both with the impact of COVID on children and young people's mental health, and also on adults, some of the wellbeing support that Ian just referred to, and also the demands on the crisis cafe. So there was a lot of concern about mental health arising particularly from COVID. The other main item was around homelessness and rough sleeping, and we had a presentation on the work around the McCure and the funding bids to continue some of that really valuable work after March. The only other point from the meeting is we identified we needed to do more work excuse me, on loneliness and isolation that has been exacerbated by COVID. Now, some of this is reflected in the report you have before you. So employment, clearly the impact of is already very apparent, and we'll see over the coming months the trends. But I think those are the key points from the officer group.
Thank you very much. Are there any questions or comments? Ashok, were you just adjusting your screen, or ask if Ashok?
Oh,
yep,
I can be unmuted now. I believe, I believe Alison can do it. Just a very small question on that, Mr. Mayor, and that is to do with, there is a almost 30% increase on the workload of the general practitioners throughout the country, but certainly here in Bedford also. And there is a almost, if not 100%, close to 100% increase on antidepressants. And I just wanted to get some kind of, some views on that. Are these the temporary phenomenons where people will be reviewed and their mental health will improve and they may not be addicted to the antidepressants?
I'm almost certainly not the person to answer that question. I don't know if anybody can come in and look at that. I think it is something we need to look at, Ashok, but Nicola's put a hand up, so I'm hoping Nicola might have some insight.
I think we've got our GP, Roshan Chawali, or sorry, Nicola.
Yes, I mean, I think we're all aware, aren't we, that mental health problems have, have increased during the COVID pandemic. I think just going back to what Ian was saying about kids and normal reaction to stressful circumstances. So some of it is normal reactions to stressful circumstances, but certainly I think not only are we prescribing antidepressants as GPs, but also referring quite a lot of people to talking therapies as well. So I think it isn't just about prescribing drugs. And just to say that antidepressants are not addictive medicines. So that's something that, don't get worried that we're going to have a whole lot of people addicted to things at the end of the pandemic. But they, generally, things like Prozac, those sort of common types of antidepressants don't have addictive potential, generally speaking. So I don't think there's a a worry about that. But I think that the capacity for talking therapies and lots of resources through that have been made available, which has really been very helpful.
Thank you. I think Roshan's come on video, so I'm asking Roshan, and I don't know if Nikki wants to come in after that.
Thank you, Chair. I can certainly echo what Nicholas said, actually, because going towards the new generation of antidepressants, there's no compared to the previous antidepressants, the older generation antidepressants, the addictive properties are very, very low on the new generation of antidepressants. But going back to the question of Ashok's, yes, we are reviewing these patients, and I have got the information from our mental health colleagues as well. Their clinics are getting quite busy as well, because there's lots of referrals are coming away, and also the reviews are happening as well. And there's a workload for the wellbeing service is going up as well. So there's a lot of recruitment. They're looking at recruiting more and more practitioners to the wellbeing service as well. So we are certainly aware of the situation, and we are always keeping an eye on the situation. Thank you.
Nikki, did you want to come in?
No, mine was just purely to make sure that Roshan, because he is our mental health lead, so
Yep.
perfect.
Yep. Good, thank you. It's a question to clinicians, as well as talking therapies. Is there any benefit to some in exercise and physical well-being to support mental health?
Absolutely, Chair. So that will be a very good thing, actually, because if you're looking at actually, because there's always there's clear evidence that the physical the activities can improve the mental health as well. So we all aware that because of the lockdown and everything, because people can't go anywhere, people are isolated. So loneliness again, everything matters. Yes, certainly it will be helpful here.
Thank you. I'm now regretting I should have said a statement rather than a question there, just to show some kind of knowledge. But thank you for the answer. I think the other thing that there is, obviously, there are benefits in terms of lockdown, some of the new technologies, and I'm impressed by some of the work a large number of people are doing, but our own team, sports development team, in terms of exercise in care homes and for keyboard warriors, so half an hour of stretching to try and get your neck and shoulders loosened up. But I particularly like the one that we do in the care homes, where you can sit there with a little set of pedals, that you sit in your normal chair and you can pedal down the embankment around Priory Park, because they videoed it, and you can go on a virtual pedal ride. I don't think you have to do much pedaling to ride. You can actually do a minimum if you wish to. But some of those things that we have thought about before but haven't necessarily done have become a force. And I think it's the more that we use, it doesn't replace other forms of exercise, but it can augment it. And I think we need to look at how we can use that for doing different things. And we've seen lots of high-end stuff where people can do fitness classes at home to sort of fit into busy lifestyles. So I think we need to look at how we can do that. And that may be a better use in terms of some people, mental health as physical health. I do remember one time, in terms of the social prescribers, somebody's depressed, I think either the mental health team or the GP paid for a £40 for allotment for a year. And that actually alleviated, and that is there's not many drugs you can get for £40 a year. It won't work for everybody, but I think we need to be, in terms of social prescribing, lots of different things. So I think the more we can look at those different things, different options for people, the better. But of course, that becomes quite complex in how we do that. And it's good to see more social prescribing happening. Any other questions or comments? Can I just add something? There was a rough sleepers and homeless bit on David on the report. So I was pleased to see when we did our count, which was I think the last Thursday in November, that we are now down to 6 rough sleepers, 2 of which have actually point blank refused to go into any accommodation. So as you said, David, the Mercure hotel is there. 2 others actually have a right to be accommodated elsewhere. but decided not to go back. And I think there are a couple that have some pretty serious complex needs that mean that they can't go into the McCure. They have been there, but have been evicted. So, and actually one of the people had been illegally evicted from their private accommodation. They're back in, so we're down to 5. So from 2 years ago, 76 people rough sleeping, to be down to 6 now, I think is really good. And there are actually 2 who are refusing. We will see some people on the streets who choose to be in the streets quite long hours, and some of which, but not all of which, are begging. But do have accommodation. But it's a substantial move forward, and the severe weather provision is in place as well now. So there is no reason for anybody to sleep rough in the streets, which is good news. And I think we should go put on record thanks to McCure, who have actually allowed us. We have a booking to the end of March, and I think they've been really good about helping us with the rough sleepers and all the staff that work there. There's a large cohort of staff that helping people in the McCure with a variety of complex needs. So thank you to everybody involved in that. Any other questions? Can we agree the report as set out?
Agreed.
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 Thank you very much. Thank you. If we now move on to item 7, which is the health and care transformation, and item A is to receive a report on the opportunities for prevention and effective treatment of long-term conditions. And this is over to, trying to remember who the Director of Strategy Planning and Population Health in Bedfordshire. I'm guessing that might be Nikki.
So, Mr. Mayor, could I introduce on the line? We've got my colleague, one of the primary care commissioning managers, called Sarah Bunn. So she works as part of a wider team that's clinically led. We've got a GP called Dr. Shirag Bakai, but we've got a number of local Bedford-based GPs that Sarah works with. So she takes us through the report, and then together we'll take any questions.
Thank you, Nikki. Welcome, Sarah. I'm going to hand over to you. Alison looks like she's trying to share something there.
Oh, there we are.
Are we
sorry, I was just, hi everybody, I'm really sorry about that. Hi, my name's Sarah Bunner. As Nikki said, I'm one of the commissioning managers. I've just got some information for you about diabetes and cardiovascular disease. So I know you've all seen the report. I don't know whether you want me to pop it up on screen as I talk through a bit, or how would you prefer me to do it?
I'm just wondering whether that is possible. I'm hoping, Alice, it is. So yes, I think that'd be useful, Sarah.
Okay, so let me see if I can.
Oh, it will just take a moment because we have to transfer presenter privileges to you.
Oh,
so
okay. Thank you. Sorry, I'm not used to WebEx. Apologies for that. Right, let's see if I can do this then.
So those of you who are new to the WebEx, we are being podcast almost live, 5-second delay on a YouTube channel. So not only recorded, but we're as live.
So hopefully you can all see that the same screen as me now.
Yes, we can.
So we've got some key milestones which have been developed in all 3 areas.
Sarah, if it's a PowerPoint, do you want to go to the presenter mode, which just makes it a little bit bigger for us all?
Easier to see. Yes, sorry. Yeah. Apologies. There we are. Sorry.
Yes. Thank you very much. That's great.
Okay, so we have 3 working groups, 1 for diabetes, 1 for cardiovascular disease, and 1 for respiratory. And for each of those, we've developed a set of key milestones that we were hoping to work through this year. I'm going to talk to you today about the diabetes and cardiovascular disease. So as you can see there, for this is the diabetes section, we've mainly been focusing on promotion of the NHS diabetes prevention programme, especially the new self-referral route, and addressing inequalities by focusing a campaign of communication targeting our high-risk groups. We're implementing the new diabetes prevention programme for women that have had previous gestational diabetes as that comes online. We're looking at utilisation of risk stratification to support prioritisation of diabetes reviews, especially during COVID recovery, and looking at providing equity of access to structured education, and again supporting self-referral into structured education, and embedding the new NHS low-calorie diet programme into clinical practice. So you can see there the things that we've progressed to date, especially around the NHS diabetes prevention programme. We've had some really good results around access into that programme, and you can see also the planned activity that we're looking at working on. The main piece around that is around linking some guidance work around diabetes and frailty. So if you have any questions, then please ask as I'm going along. So just a quick overview of diabetes in Bedford Borough. So you can see there that there are approximately 735 people in Beds Borough with type 1 diabetes and just over 10,000 with type 2. And the strategies that we've got in place fit into 3 main sections: prevention, support and treatment. And we've got the More Life support there around prevention, around weight loss and diet. We've got the NHS Diabetes Prevention Programme and the monitoring of people at high risk of type 2 diabetes. For support, we've got structured education programmes, which we'll go into in a bit more detail. We've got Diabetes UK Support Group, and we've got some really good integration with IAP psychological wellbeing services. And for treatment, we've got the individualised care planning approach, which is doing really well in Bedford, and the low calorie diet programme. So just a refresh there for everybody. I'm sure most of you know about the risk factors for type 2 diabetes, but these are the things that we're trying to address with most of the work that we're doing. So the NHS prevention programme, we've had just over 1,000 referrals into that programme from Beds Borough since ICS took over in August, so that's a really good result. And obviously I said before, we've had this change in delivery format, which allows self-referral into that programme by utilising the Diabetes UK Know Your Risk tool. Just a quick overview there of how diabetes has been affected by COVID-19. So we can see that the odds of related mortality are quite high for patients with diabetes. So that's why we've been really conscious about making sure that we've got that risk stratification in place to support the right people being reviewed at the right time. So the low-calorie diet programme, it's felt to be very revolutionary in type 2 diabetes care. There is strong evidence for potential for remission. The key mechanism through which this works is through weight loss. It's a total diet replacement programme with behavioural support. We did an initial pilot of this similar programme in Luton, and we had an average weight loss of the participants of 14 kilograms, so it's been hugely successful. And following that, we were successful in bidding to be a pilot site for the NHS programme, and it will be launched across Bedford. It was launched across Bedford in late September. And I'm not actually sure at the moment how many patients from the borough have been included in that programme, but I could find that information out for you if that would be helpful. So structured education, there's just an overview here of all the structured education that's available for people with diabetes in the borough. So I don't know if anyone's got any queries about any of that. The My Desmond is a new interactive web-based platform which has been pushed through because of the pandemic, because obviously we weren't able to provide face-to-face support for patients. Within general practice, obviously, we've had some reduction in the number of face-to-face reviews of patients. We pulled together a supportive package for GPs to help with the stratification process, and a guidance document to provide a two-stage review process, which is done initially virtually, either with a video or phone call, and then follow up where required face-to-face. We've worked very hard with providers to try and get a sort of a one-stop shop basis for that, so that patients don't have to see too many people on different occasions. So I don't know if anyone's got any queries about diabetes before I move on to the cardiovascular disease.
Are there any questions? Ashok, were you indicating there? I think we'll...
No, but stunned you all into silence. Okay, I'll move on to the cardiovascular disease then. So again, we've got a set of key milestones that we've developed for cardiovascular disease. You can see there that we were looking at better identification and management of people with familial hypercholesterolemia, improved education and self-management support, including pharmacological management of people with hypertension, greater and more equitable access to cardiac rehabilitation, education and care planning to support self-monitoring of people with heart failure. Again, you can see there the progress we've had to date around integration with IAPT services, the development of a supportive self-management pack for hypertension, and we've also rolled out blood pressure monitors to general practice to loan out to patients where patients weren't able to access home monitoring. So just a review there of hypertension. So I'm sure that you all know the risks surrounding hypertension, and there's just under 26,500 people across Bedford Borough who have been identified with hypertension. But we know that there's a huge amount of underdiagnosis and also inaccurate diagnosing of hypertension nationally. So I'm sure those figures aren't 100% accurate. And then just the risk factors around hypertension. So again, I'm not sure if anyone's got any queries about any of this. Then there was I just thought it'd be useful to share with you our thoughts around the rolling out of blood pressure monitors. So as we've said in the last couple of slides, we know that hypertension is a really important risk factor for the development of cardiovascular disease. And we know that we have issues around lifestyle behaviours, and that sedentary behaviours and weight gains have definitely increased and worsened due to the pandemic. Home monitoring of blood pressure is recommended by NICE, and the widened inequalities from COVID-19 means that we were very conscious that there were families where even spending £20 on a blood pressure monitor might be a step too far. And also alongside that, we've had that reduction in face-to-face and ad hoc opportunities for blood pressure testing. So what we wanted to do was to provide practices with a small number of devices that they were able to loan out to patients for that initial identification and monitoring of blood pressure, but also when they were doing any kind of change in medication, they'd be able to loan them out at the same time. So that's just a I've done that one already. Oh, going backwards. There we are. So our hope with the provision of the monitors that we'd get improvement in identification, monitoring and treatment of hypertension, that we'd see improvement and the improvement in these areas we'll be able to see through an increase in recorded prevalence of people with hypertension, an increase in the proportion of people who are managed to target, and a reduction in preventable stroke, reduced hospital admissions due to cardiovascular disease in the long run. So we had 187 devices that were made available to practices across Bedford's Borough, and I believe a majority of those have now been received by practices. And we rolled them out with a patient management support guide, which is embedded into here, but it doesn't allow me to open. So I'm hoping that you've all had an opportunity to see that. If you weren't able to see it, I can send it around separately if that would be helpful.
Thank you, Sarah. If you could send, and it's a general view that embedded documents don't tend to work when you send them on. You've got to be, okay. I think that's not just you, but it's also some of our own within council. Unless you're on the hosting system, you can't see those. Great. Can you just thank you for that? Can you stop sharing if you can? I know you're clearly looking for the stop sharing button.
Yeah, sorry. Is that different? There we go. Hopefully that has.
That's wonderful. Thank you very much. So that's now your level 3 in WebEx. So congratulations. We will send you a certificate. We will send you your certificate shortly. Ashok.
I shall look forward to receiving that.
Well, thank you very much, Mayor. I'm absolutely pleased to hear the report. However, I've got a couple of questions, Sarah. One is the work you're doing on the silent killer, which is the hypertension, is a good one. So that's great. Thank you very much. But I think my main question is related to the South Asian community, who is the main sufferer of all the long-term conditions we have just described. Going back to diabetes, although I applaud the low-calorie diet intervention which you have started here, which is very, very good, and obviously it is going to have a positive effect. That, along with the education program which you are starting mainly based on Desmond, is fantastic. However, 30%, well, first, 8% of the Bedford population has got diabetes. Let's start with on that. 30% of the total population is the ethnic minority population in Bedford. And the very large proportion of that has got these long-term conditions, particularly diabetes. So the education and low-calorie diet is the most difficult thing to deal with the BAME population. And I just wanted to hear from you, what are the special attempts you are making to bring them into this very well developed programs, which is very much welcomed. Thank you.
Thank you. So it's a really good question. So as I said, we've done some targeted comms into specific communities, especially around the NDPP program, which is available in different languages. We've also done a lot of communication and work with local faith leaders, so it's very much about targeting communication at the moment. From a low-calorie diet point of view, that's also available in alternative languages to English, with alternative support around reintroduction of diet when it gets to that stage. And we have had successes with people from BAME population in the Luton project.
Ashok.
That's great. Thank you. Thank you. If you are getting success from Luton into BAME, BAME community in this, I applaud it. However, unfortunately or fortunately, most of the faith practices in the South Asian community, the diet or the high calorie food becomes very important, and we need to have a very high level education with the faith leaders.
Yeah, so we've had some, sorry.
So I was just going to say, Mr. Mayor, if you would like, Dr. Chirag Mackay has got a particular interest. So if it's helpful, Sarah can arrange a conversation with yourself, because again, really value that local knowledge. But because it's about building on the work that we've done previously, but he is actually linked into the national team, and he's got a specific interest about how we target different groups, so that we really, as you're saying, hit the mark.
I'm sure myself and Councillor Jackson would like to have that meeting, and maybe we could sometime also discuss that with Health Watch as well. It'll be really good. So if we can set that up, thank you. And I think we will, the attendance that we have at the faith leaders meetings is pretty good. We do seem to be missing some faith leaders from the Muslim community, but I know that the police who are successful in getting that, we're merging our two meetings. So I think beyond COVID-19, those health meetings will continue and allow us to do that. So I think the last one we had about 35 faith leaders on for the borough, and we'll look to try and grow that and look at particular issues. So it's allowed us to engage with far more people who've wanted to know the up-to-date data on COVID-19. But I think we'll take that to move it forward and have particular cases where we would look at particularly diabetes and try and share that with some of the faith leaders and community leaders. So I think there are great opportunities because of the willingness of people to try and engage in what the latest information about COVID-19 is, that we can use that to build on other ones. I must admit the vaccine, and we haven't mentioned the V word yet. The bit I find really exciting is the fact that when the scientific world got together, we managed to, or they managed to provide a vaccine that had been fully tested within 9 months. And wouldn't it be great if we could think about another target to have a vaccine to cure within 9 months, that the scientific world got around it. So the next one, answers on a postcard, what you want to see the next big piece of work on. The opportunities are huge, including of course diabetes. But prevention is possible, of course, to a large extent. But if we can, Sarah, try and set that up, that'd be really good, or Nikki. That would be wonderful. Other questions? Okay. No other questions? Obviously, Sarah, if it's been successful in Luton, that we'd really like to look at how we can learn from that and try to make sure we pick up any best practice. Quite happy to steal best practice from elsewhere. Not ashamed any way of doing that.
So the learning was put into the national programme.
Good.
So that's great.
Okay. In which case, thank you very much for your report. I think there's some work to take on outside the next outside the Health and Wellbeing Board to try and move that forward and do some of that education around the conditions outlined. Thank you very much for that. Happy to receive the report.
Content. Yeah.
Thank you very much.
Okay.
Thank you.
Yes.
Thank you for that. I like the style, Nikki, there. You present a report and get somebody else to do all the hard work. I must learn from that. Thank you, Sarah. Moving on then to item 8, which is the health and care transformation. And item 8, to receive a report on the opportunity for prevention. Have I got the right bit? I haven't. Recovery plan, aren't we? So the general update, provision of access to health services in Bedford Borough, given the COVID-19 situation. And this will probably be Nikki herself now, isn't it?
Sure, but yep. But Mr. Mayor, I have to say it's all other people that do the hard work. Believe me, I do work hard. But this is, you've all had the opportunity to read the report. And if I just try and make it a bit real, because what Sarah has just mentioned about the work for diabetes and hypertension, that's an illustration, and you can realise the depth and breadth of the work she described. So that's an illustration within this report. For example, we know that people with type 1 and type 2 diabetes are high risk of COVID, hence why general practices and the community providers have worked really hard to ensure those people with those conditions actually have come forward, because we do know during COVID a lot of people were frightened to come out, hence they haven't come forward to general practice, or whether they were having any treatments in a different setting. So what I'm really wanting to get across is that on this report, this is within the NHS, all the data proves, is the evidence in itself is that, for example, people were not presenting in the A&E departments you'd want to. So we do know things like presentations for strokes and heart attacks were considerably down. And you may remember feels like a few months ago about the message about the NHS is open and encouraging people, because we've opened up screening where some of those services were paused during COVID. So, for example, breast screening, bowel screening, those screening opportunities, are recommenced. So, this report really, if I just whiz through, so cancer, the elective work, mental health, I know that one of the colleagues talked about earlier, and particularly supporting people with learning disabilities that we know are disproportionately affected by COVID. And again, as I say, primary care and community. So that's what that report, Mr. Mayor, has actually got within it. And you can see it's all interfacing. And the most important thing is that we as the health system are working that Freudian, that system, we're working together. So patients just see a seamless provider of health services. So as you can see, that we are really, cancer has been a very, very important area, making sure that we don't delay anybody's treatment if they come forward. But secondly, as I said, making sure that we're encouraging people with any symptoms to attend. And you can see that these reports that we monitor weekly, I mean, they're on a daily basis, that this report you'll notice dated the 13th of November, that will be meeting the deadlines for your papers. So I don't want to go too much into the numbers in here, other than to emphasize that 2-week wait, we're back on track, is that together as system players, we're making sure that there's no delays in any of the cancer treatments. And clearly, the whole purpose is keeping a safe service. So just give you an illustration. So some diagnostics like endoscopies are, just by the nature of it, is that they're more tricky to make sure that we are keeping people safe from COVID. So the length of time it takes a clinic to do the amount they did pre-COVID to now is less than half. So it just gives members of this committee an understanding of why this recovery and management of COVID is so important. So I'm just going to pause there and see what questions we have.
Any questions from anyone? Kate?
Hi, it's just in reference to people with learning disabilities. It's good to see, that they're strongly captured here, and obviously through COVID, they're particularly susceptible to the virus. I'm just wondering, where you mentioned the health checks, if you're able to share the local information on the number of health checks undertaken in this year during COVID, or where the lag is, because that's something I think health and social care can work on together with some of the local providers to push that forward, particularly as people have had fear of going to GPs and maybe still obviously following the rules and remaining behind closed doors, just with the risks that we know exist. It's really helpful to see that and I'm aware of the mortality reviews that are going on, but really so we can prevent those mortalities, it would be good to know that the early prevention and the status on the health checks for people with learning disability through that register with the GPs would be really good.
So I can certainly get that to you, but equally Roshan is clinical lead, so he may want to add because he's very close to it. So I'll pause for Roshan for a moment.
Hi, thank you, Chair. Thank you, Nikki. Yeah. So because I think this is a factor that we have found. Actually, there's a lot of learning disability patients has been affected during the COVID time, because there has been reported, unfortunately, there is a lot of reported deaths as well within this time. So there's a big program at the moment is going about looking at the physical health of these patients. The GPs have been given tasks for monitor these patients. So we have introduced actually what we called as one-stop clinics in surgeries to do this piece of work, because getting the patient in, getting the blood test, and getting the routine reviews done at the surgery itself. So I can give an assurance actually, because we had been because within my practice itself actually we have now come to about actually, because we have now at the moment we have completed out of about 80% of these patients assessments done within our practice itself. So the system is moving very rapidly from the surgeries, and this has been really taken up by the GPs to give this piece of work from their end. So yeah, thank you.
That's great to hear. Thank you. Thanks.
Thanks very much. Any other questions? No, Nikki, anything further?
No, just to say that it's, this is continuous, so it is, managing on a week by week basis. But I will say at the moment, and this is literally our community providers, GP practices and the acute working together, is that I think we are probably one of the better systems at the moment. So just keeping your fingers crossed, but lots and lots of hard work out there.
I just think the other thing to remind the public of, and I think we need to make sure collectively we probably increase our communications, because as the vaccinations come out, there is a view, if we don't fill the void, it's filled by others who think that the vaccination is either irrelevant, a con, or that we can just go around our lives in a normal manner. And we need to make sure that there is still months ahead where we've got to do hands, face, space, socially distance, and be aware that COVID-19 still exists. I think I saw something last week or heard something that said 28,000 NHS workers are isolating. The pressure on the remaining ones will be immense because of that, and that's happening across the system, across the country. So if we are to protect our NHS and make sure we protect the staff that are on the front line, including the ones on this call, we need to make sure we have as many of them as working as possible, because that just lessens the load. So anything we can get out there to say it is, beginning of the end, maybe. But we are still some way to go, and we need to continue to actually have that social distancing, wear face masks, hands, the hygiene, all the things we've been talking about. They haven't disappeared because the first vaccine has been given. We are some way away from that, and I think it's probably our job to make sure we up the levels, because there is that hope and think, well, I can go out now. It doesn't matter how many people I meet, and that is definitely not the case. And that will just allow, if we can do that, allows more of these treatments that Nikki's been talking about to happen, which is so important. Thank you very much, Nikki. If there are no other questions, happy to receive the report.
Content.
Okay.
Thank you very much. So thank you for Alison P. being the first one to spot and send me a private message to say you've missed 7B. And Sunita, sorry for, you maybe thought you were getting away with no report on that, but can we go back to 7B, which is receive an update on the progress of the seasonal flu plan? Is that Sunita? Yes.
I've got Nicola, Nicola might present the highlight report, and the week 47 data is available, hopefully, with the papers. Nicola, did you want to present? I'm happy to take support. Nicola on the call?
She is. Probably trying to find where the buttons are in the system. There we go.
You're speaking to me. I wasn't expecting to present it. So.
Okay.
Sorry.
I can do the highlights then. So the highlights are that across Bedford Borough, all of the practices in our PCNs, we've achieved the 75% uptake for over 65s flu vaccinations. The practices where we are seeing that it's not quite 75%, we are putting in additional resource and support, along with support from our community providers, to make sure that those patients are vaccinated. Some of our practices have vaccinated over 81% in that cohort. There is significant improvement in the flu vaccine uptake for all of the other cohorts. The cohorts that we are particularly challenged with are carers, and there we are putting in additional support through the local authority colleagues, public health colleagues, working with the carers organizations and putting in carers cafes to improve awareness. And now that the vaccine is more readily available, we are signposting carers to pharmacies and practices. Other than that, the program to vaccinate healthy 50 to 64-year-olds have come online, and practices have started to invite people 50 to 64-year-olds to come in for their vaccination. However, in this age group, our priority still remains to vaccinate the under 65-year-olds who are at risk. Again, a lot of work is happening with our hospitals, our community providers, and our patient groups such as Epilepsy UK, MS Society, Macmillan, to make sure that we've got our patients signposted to go and get their vaccine. There is a national recall also happening, calling all the patients who are under the age of 65 and identified to be at risk and still haven't taken their vaccination yet. So we hope that will improve the uptake. Bedford Maternity Unit has started to vaccinate pregnant mothers. That will improve the uptake in our pregnant mothers. Our practices are also actively calling our pregnant mothers and vaccinating them. The recall for 2 to 3-year-olds has also taken place nationally. This is an area of focus for us as well. Again, we've got collaborative working with our children's centres, our early year settings, health visiting colleagues to again signpost parents, and particularly in those parents where for cultural reasons the flu vaccine is not taken because of porcine content. There is now the availability of the alternative vaccines, and making sure that all of that is communicated. Significant amount of communication is going out to lots of our communities and targeted to with our community focus groups and community leaders. We are doing another round of videos which are going to be by our community leaders with support from our comms team. So we still continue to focus on the flu vaccine, although the COVID-19 vaccine is the main focus area, and we welcome support of Health and Wellbeing Board members to continue to support us on the flu vaccination program alongside the COVID-19 vaccination program. I'll stop there. The highlight report is there, and week 47 data is there for board members to see. Happy to take any questions.
Thank you, Sunita. I think you said that one of the PCNs had an over 81% of the over 65s. Presumably that's that the week 47 data isn't showing that. Is that subsequent to week 47?
Yes, Chair. Since the submission of the papers, we've got week 48 data, which is showing that. I'm happy to share that with you as well.
Any questions or comments? Kate?
Just thank you, Sunita, and it's good that we've shared the information with Bedfordshire carers, to improve the uptake of carers. Regarding paid carers and staff in our care homes and regulated services, because the rollout of the vaccine at different times, I'm aware that some carers went and were turned away at that point earlier on in the programme, and we're doing lots to encourage the take-up. I'm just wondering, something that's come up actually this week, is there a way of carers or anybody, in fact, finding out where the best pharmacies are of had deliveries of the vaccine early, because that's the thing that seems to have been a bit of a barrier, because when people have been and there wasn't any available, you don't go back. But if they knew what was coming and they could book their slots with one that has a delivery, it might help to speed up and the uptake as well.
So yes, thank you, Kate. We did try to get that information well ahead at the beginning of the program. It was difficult to get it from the pharmacies because most of our pharmacies are part of big multiple conglomerates like Asda, Lloyd's, and they always don't know when the central supply is coming through. So they could not give us that information. But however, most recently in the last week, we have done that. We have done more work with our community pharmacies to find out where there are vaccines now, and we are working with local authority colleagues to signpost our carers to those pharmacies where the supply is there, and doing some work with Vicky and colleagues in public health to make sure that they've got eligibility letters to take to these pharmacies as well. So we've done that mapping now, and we are happy to share that data, and we're working proactively to make sure that they're signposted.
Thank you. It's more about, I'm aware of the letters and the encouragement, and that's been really positive work that's gone on altogether. It's just really about being able to regularly share where the vaccine is available, so people don't see a list from 2 weeks ago arrive and the vaccine isn't there. It's just really live information.
Absolutely, Kate. And we've asked for this last time because people were being bounced around between GPs, pharmacies to GPs and back again, and then just giving up. And we do need, this is all public money, and we do need to people need to write to people. We need this to be transparent about where stuff is, where the vaccine, where the flu vaccine is. And it doesn't seem to be transparent. You know, we are having this national scheme for the flu vaccine. We do need to be transparent, and we need to be timely in our transparency as well. It's really worrying that we are about just over a third the way to hitting our carers target. Having never chaired a health and wellbeing board where we've hit our flu vaccine targets, I'd really love to chair a health and wellbeing board where we hit targets. It'd be really nice to do that. So whatever we can do, but if I needed for next year to say this information needs to be out at the beginning, then I am quite happy to write and cause a fuss. But I don't think it's acceptable for public money to be spent on this and not letting people know where they can get that. I think that is unacceptable, and you can't use the fact, oh, it's commercially sensitive. This is really important for the health of our carers and those people they care for. So whatever I need to do to make sure it is more transparent and available, I will do, and would welcome working with you to get to that position.
Absolutely, Mayor, very happy to work together and see what we can provide. Thank you.
So I think we raised this this year in February, but we'll come back to it, and let's see what letters we have to write, to whom we have to write, to make sure it happens next time. Okay, so hopefully we're now seeing lots of people in the carers range being raised, and sort of by week 49, we will have some better figures than that.
Absolutely, Chair, and the week 48 figures continue to improve, and our uptakes are significantly better than we've had in many previous years. And as I said, with regards to the targets, with the over 65s, we have met the targets. There is only 2 or 3 practices where they're within their 72% ranges, and we are still working with them to get them there. With the others, of course, they're not 75%, but the data continues to improve with regards to the uptake. But the flu program continues into March, so we will continue, and this program is not going to stop in spite of the COVID-19 vaccine coming in. So we will continue to vaccinate. So as I said, we'll continue to improve the uptake.
So Nita, am I right though that it continues to March, but the most likely months for people to get the flu are January, February?
You're right, Mayor, and that's why we want to get majority vaccinated this side of Christmas. So, and that has been the main effort, and a huge amount of effort's gone in pharmacies and practices to do that.
Clearly, today is a half glass empty day for me. I have days when it's half glass full, but if I look at the where we are with 9 days to go into what we thought was a sort of a Christmas cut-off, we have hit one of the 5 targets. Understanding a lot of work's been done, but we've got the over 65s. We're not there on the 6 months to under at risk. We're not there the all pregnant women. We're not there the carers, and we're not there the 2 to 3 year olds. So we've got a very busy 9 days to get it in before what we discussed as a date of the 18th of December, I believe, back in August, I think. So hopefully we'll do all we can, but we need to do more publicity. I'm not sure it can be achieved, but let's give it a go. Phil.
Thank you, Mayor. Any support will be really helpful around the publicity.
Phil.
Thank you. One thing I've not heard confirmed is the time frame between having the flu vaccine and having the COVID-19 vaccine. Now, I do appreciate that that time frame may differ dependent on which COVID vaccine is being administered, recognising there's only one approved at the moment. But I am starting to get questions about what is the timescale from one to the other, particularly given the delay that's occurred in some areas of delivering the flu vaccine. Is that on the CCG's radar to clarify that for our residents?
It was a question I asked at the last Health and Wellbeing Board. Nikki?
So I can answer that. I can answer that one. It is in one of my frequently asked questions. I'm going to have to check, but I think I need to check, but I think it's 14 days. But I will drop it down unless one of my GP colleagues has read it. I have to say things are changing. It was longer than that at one stage, but it came to 14 days. I think that was last week.
It's a bit shorter now, isn't it, Nikki? Just to support you in that, it's okay because we're starting with the 80-year-olds who should have already had their flu vaccine and there's high uptake. So if we get started with those, by the time the people have their flu vaccine, they should, and the COVID vaccine arrives, it should be absolutely fine. I think I'm not too concerned about the timings, but you just need a bit of a gap just to make sure that any side effects are reported.
We do need.
I will do that to you because it actually came from Region and I read it. I think it's 14 days, but I will confirm to you in writing. That is the gap between the flu and the first COVID vaccination, as Nicola has just said.
Kate?
Well, it would be really helpful to have it in writing because it's really, really critical in terms of the care staff and the vaccination programme, because I've been given a much shorter indication. So it'd be really good that we get it clarified. I'd heard it was 5 days because that's a really up-to-date question for us to know in the care services right now. Because we're first.
And this is why we must.
I will confirm within 1 hour of this meeting.
And this is why we need to make sure we put stuff out. And I was disappointed last Thursday to get some information about the vaccine during the meeting, the engagement board that the Prime Minister asked me to chair locally, about where we were with the vaccine. I know there are massive uncertainties, but we need to be sharing that and getting out there and doing the public. Otherwise, that void is filled by people that have absolutely no information and are clearly making stuff up. So having given 48 hours to say I need an update on vaccines, I was bitterly disappointed to have to read it while chairing the meeting about where we were. We need to, as collectively, as the people that have more information than others, not be waiting for some national approval, if that's the reason we're waiting for it, but we need to make sure we get that information out there. We will now have carers who believe they're going to be vaccinated because the publicity around the vaccine is in the next few days, deciding not to have the flu vaccine because they're waiting for the COVID vaccine. They might do it in 5 days, but if it's the 28 days they had previously, so we need to have a very, very clear message, Nikki. So grateful to receive the update within an hour, but I think we do need from colleagues around the screen, and Jane and team may work with our comms people to say what is the message about, if you're a carer, are you going to work in a care home? Should you have the flu vaccine or should you wait for the COVID vaccine? And we need that really quickly, and we need it clearly, and we need it in every platform and repeated probably hourly to fill a void that's been filled by other people. So I think it's really important we do that. And if people nationally say differently, make a phone call and I'll say it, because quite honestly, waiting for their approval is really not good enough. I thought we had a GP on, no, so we had a doctor on from a hospital. I thought was exceptionally good. He said the most dangerous thing about him getting the vaccine by some magnitude was the drive to the vaccination centre, which is far more dangerous than anything else he's going to do in terms of getting the vaccine. And that's the kind of message I think we need to get out there, because there are some incredibly amount of disinformation going around. And that's because we're not filling that void. So if we can have that data, thank you very much for the update on the flu vaccine. I know we're better than previous years, but as I said, I really would love to chair a health and wellbeing board where we hit all targets on this. Thank you very much, Sunita. Appreciate all the work you're doing. We will now move on to item 9, which is the primary care network. Just as we move into this, Phil, Chief Exec, may have to disappear because he's got another phone call coming in that he has to take. So you have to disappear, Phil, during this. I fully understand. I'm sure others would as well if they knew the reasons.
Thank you.
So moving on to the PCN update, Nikki.
So I'm going to do a double act with Ian, because Ian Brown is the mastermind of the population health work, and equally with Roshan, because he is one of the GPs in the 4 networks. So I'll go through relatively quickly because this will be known to many of you, but you all know that you've got 4 primary care networks in the Bedford Borough. And I think the challenge, quite rightly, you gave me when I started was actually what have we achieved? So, and again, I hope Kate can support in this element. So certainly with COVID, the one thing which I think the PCNs have helped enormously with is actually about working and with the care homes and alignment. So at the moment, I have to say, fortunately, it's across Bedfordshire, Luton and Milton Keynes, and I'm proud to say that, but particularly with Bedford, no, I just because it's really, really important, because all of our GP...
Sorry, Bedfordshire and Milton Keynes.
Bedfordshire, beg your pardon, I stand corrected, I apologise, allow me that mistake. But we have got all of the care homes, and there are quite a number of them. And again, that's the absolute support of working with Kate and the team. So we've got that alignment. So we've got a weekly check-in. And I think, again, Roshan would be more of authority on this. It's about the relationships with the care homes itself, the relationships with the community providers, and those teams that work in the community of mental health. And it's getting that personalised care. And I think the other is the amazing, and that's a fabulous piece of joint work, of actually getting the iPads, so that where possible, and where it's safe, is that the consultations can be undertaken remotely. And I do stress, if people need to be seen and a clinician needs to examine the patient, or indeed the patient believes that they need to see a clinician, that would be a clinical judgment, that takes place as well. So I think for the Bedford Borough, it is our 19 practices work very collaboratively and to get that offer going. So if I just, on the slides that you've had, so that the first slide I gave you was literally just about the you could say the structure of it. Ian, do you want to talk about the work that Caritas has done? Because noting that Caritas have actually, they're the PCN that are trailblazing for the other 3. Do you want to just explain some of that work?
Sure, I'm happy to, yeah, absolutely. So I think one of the advantages that working in PCN configurations gives us is that it allows our GPs to think about their population in a different way. It allows them to share good practice amongst their constituent practices. And so for Caritas, which has 6 practices within it, we've been working with them as part of our wider 22-week population health management development programme across Bedfordshire and Milton Keynes to use data in a new way. So we've brought together primary care data extracted from the 6 practices, but also from many other practices. I think We've got certainly more than half of our practices across BLMK now signed up as part of this program. But for all 6 practices within Caritas, we've extracted the GP data. We've linked that to hospital data, but also community and mental health data streams as well, so that we can present back to the PCN a view of their population that they've not seen before. And we can start to think about within that group, what cohorts are there who are experiencing similar health outcomes, but also have shared characteristics and vulnerabilities, and how might we therefore design services and engage with those groups in a different way that meets this sort of quintuple aim, as it's now being called. I'm waiting. It's a bit like Gillette razors. They seem to add a new blade every year to the aim. So we're up to 5 now. They're all very well-meaning aims. But how are we improving the health of the population? How are we improving the experience of care? Are we making care more efficient? And are we making it an engaging and good job to be in? And also, are we making sure that whilst doing all of that, that we're also addressing inequalities in health and care as well? So that's our sort of quintuple aim. So it's quite ambitious. And what Jane has done with her PCN and what she's been championing has been identifying a small cohort, a cohort that's big enough to make a difference, but small enough to be able to intervene with as a PCN. So the cohort that they've identified using a data-driven approach is adults who are aged 20 to 74 who have hypertension and depression, but we're also identifying as socially vulnerable. So that's a flag on the GP system that may mean that they're in receipt of some form of social care, or maybe some other reason that they've been flagged as socially vulnerable by their GP. And then look to see how could we deliver services differently so that we could improve the activation of those patients so they can look after their long-term conditions more effectively and improve outcomes for those patients, but also recognizing that there may well be other practical, financial, emotional challenges that are sitting behind some of these diagnoses that we also need to give support to. So that's the piece of work that we started with Jane, and you can see there on the slides there is also you can see a slice of the data there and how we've been able to look at all those elements and identify that cohort and see, for example, where we have high spend in non-elective activity in some of our practices, where we have higher spend in mental health in others, and that's a cohort that's really brought together the 6 practices who are all keen to work with them. And we've also factored in the COVID risk into this as well, using the Liverpool COVID risk score, which includes information on COVID mortality, but also risk factors for COVID as well, including the proportion of the population from ethnic minorities, for example. So we can see that we've got practices who have a relatively high COVID risk score, high levels of social vulnerability within this cohort, depression and hypertension, as we say, in all of those 77 individuals. And then what we've done is, using that data, we've brought together as part of the PCN, and the PCN I think is much wider than just the GPs and the GP staff. It's the social prescribers, it's the local community mental health team. We have a lifestyle hub in Bedford as well, which provides referrals into some of our lifestyle services, and we have the clinical pharmacists in the team as well. So working together, we've been identifying what an intervention would look like for that cohort, how it might differ from what they get currently. So how can we personalize that for them? How can we encourage patient participation and self-monitoring for their conditions? Then we've looked at actually what would be the short-term outcomes for them in terms of improved resilience, improved physical activity, improved self-reported well-being, and what would be the longer-term outcomes for the way they're managing their conditions, for their cardiovascular risk, for example, and for their use of non-elective services, for example. So it's taking a population health approach in a way that is practical and achievable and measurable as well. So we're about halfway through that journey now, and I'll be really happy to come and report back, perhaps with Jane as well, to tell you how that's gone. And I think the other thing I would say before I finish is this has really been a developmental opportunity for the PCN as well. So they are now working much more closely together as a result of this. They've really got all of the practice managers and the GP leads across the system, across their mini system involved. And I hope it will sort of accelerate their journey as a PCN.
Thank you. Nikki, anything else you want to add?
No, I mean, I think it's just important that if any questions really come up, And I know previously one of your councillors was saying how busy general practice is. Certainly it is. And if you remember, I was saying that general practice is a 24/7 off. So the 111 service, obviously GP practices closed at night time and at the weekend. So for me, it's just being absolutely clear. It's a seamless service. It should be.
Any questions? Any comments? Just in terms of statistically, is 77 statistically significant, Ian?
It's the sort of motto of the program is start small and scale. So we're hopeful that this approach with the 77 individuals will make a difference for those 77. We will be able to measure statistically significant differences in some of the outcomes, like their blood pressure, from the point of entry into the program to the end. We've not done power calculations. I will give you that, but this is a cycle of learning and it's something that we can hopefully scale and approach. We're doing this work not only in Caritas, but we're doing this work in PCNs across Bedfordshire and Milton Keynes. And they actually share a lot of similarities in terms of the cohorts that they've selected themselves. So we will be able to share that across. We will be able to see some benefits, I suspect, across the system as a result of this. And we're also looking to do some work with the nascent ICPs as well, because we recognise that some of the benefits from population type approaches obviously are only going to be achieved if they're done at scale. So we'll be looking to see how we can involve our acute partners in that work as well. But I think this is a great way to start. And I think as well, some of the work that we're doing, for example, with our social prescribers around this could easily be extended to our other PCNs. The cohort that we've identified, you can imagine, will be replicated across Bedford and across the wider system as well.
Thank you very much, and well done for picking up the geographical comment I made to you. Councillor Valentine.
Yeah, thank you, Ian, for this information about PCNs. And my question to you is about health hubs, because certainly south of the river and in Kempston and Kempston councillors have been talking about this for many years. The problem is not that the GPs aren't necessarily cooperating. I think they're doing so very well. The problem is with oversubscribed GPs and inadequate buildings, and that's what the health hub concept is about. And I just wonder whether you can give us an update on that, whether we're still pursuing this concept, and basically where we are on this.
So, Mr. Mayor, would you like me to answer that?
Yes, please.
So that we've had this discussion with yourself and the CEO about our estate strategy, and the estate strategy, of course, it's completely aligned to the PCNs, but they're slightly different. So what I have promised, they are slightly different because the PCNs aren't about buildings. The primary care networks are population focused. It's not about a building. There was never a suggestion within the national policy that we have 4 PCNs currently in Bedfordshire, that there will be 4 sites. I know they're aligned, and it would make sense because co-location does help with seamless working, but that has never been that wasn't how the policy initiated about primary care networks. The whole thrust of developing primary care networks through an NHS policy was about resilient primary care, and as you know, it's that balance between personalised service, which I know many health watches mentioned to us about smaller practice give a more personalised service, versus the resilience of the workforce. So I'm very happy, and if you'd like to do that at a next time, to go through the estate strategy. I've got a colleague in the CCG called Nikki Barnes who actually holds the ring on the estate strategy, or we can do it outside the meeting if that helps.
I think I'll be grateful to come back, because the analysis that we jointly fund or bid for money to fund shows that our estates is 42% less than is needed for the average. And I do think that has impact on our GPs and the ability to recruit GPs. And we've discussed that offline. And I'm quite happy to discuss it further here, but I do think it doesn't help in terms of the ability to recruit GPs if there isn't enough space for them to comfortably work. And there have been some very protracted attempts to increase the space, and there has been some failed attempts that has lost money to the public purse, considerable money to the public purse, where developers get to pick up that money. And it is not in my job to increase the profitability of developers. I'm there to try and serve the residents of the borough. So I would like that to come back, because I worry about the speed of that happening. And I understand that it's constrained by some of the bureaucratic systems around the NHS procurement and contracts. But we have had conversations with Nikki Barnes at some length, and we don't seem to be moving the speed that I know James's colleague in Kempston, but I'd also think Gilbert Hitchcock House has been some time coming, and then we've got lost opportunities in Wootton, in some ways in Great Denham, but also in Wixham's, and a very protracted a case which eventually come to fruition in Shortstown as well. So it's not just one case. So I would love to come back and discuss that. I've also had conversations, as you're aware, because you're in there, about the size of the PCNs.
Sure.
And the paper that you shared about what the ideal size was, understanding that they can go above and occasionally beneath, but the Caritas one is under 2,000 patients away from the maximum size, and I think you are all aware that my view that it is far better to have a smaller one, and that goes to this some of the issues around small practices. I think smaller PCNs don't necessarily go to the huge size that you get in some around the country, but Caritas is pretty close to it. And obviously East Beds is over the size. You could then say from the previous item, they are the one PCN that's not hitting its flu vaccine. Is that because they're too large? I suspect the two are not connected. However, it is over the ideal size that the NHS said that was shared with me, and you convinced me some time ago as a collective organisation was the correct thing to go for. As you know, I believe there should be 5 for the borough because that allows for growth. We've had those conversations before. I'm just going to put that on the public record here.
And Mr. Mayor, if I could equally, because we've got the same goal here, because within the primary care network, there is something called additional role reimbursement, and that is part of the policy about increasing the multidisciplinary workforce. So you may be aware previously it was community pharmacist and social prescribing, that was previous. Group health professionals, telling where we are within the CCG about this. So
thank you very much, Nikki. And thank you for the work for Caritas. It would be interesting to see the outcome for those 77, and it's something that I said, let's start small and see if we can get some successes. Are we happy to note the report? Are there any other comments? In which case, thank you very much. I'm sure we will discuss this more in my next meeting, which it seems most of the screen are in the next meeting at 3 o'clock. I might be a little bit more vocal there about that than I am here. So that's an ICS meeting for those of you who aren't there. So I think most people seem to be in that. Moving on then, if we can, to item 10, which is the Better Care Fund. Kate.
Making sure I'm unmuted, sorry, couldn't find the button. Just, I hope everyone's had the opportunity to look at the Q2 report reflecting on what's been happening here for our Better Care Fund. Just to highlight really, we're in the 6th year of the Better Care Fund, and it's the 5th BCS plan that we're working on. Achievements and stepped improvements throughout. Just to highlight really a couple of areas on the performance and the progress. Reducing inappropriate admissions for older people 65 plus into residential care is we've seen a total of 71 people admitted, which is a reduction from 90 in the same period last year. So I think, you know, that shows that there are some improvements being made. And that's even with the COVID being played out, you know, along the backdrop of this. It demonstrates that the social care provision is meeting people's needs in their own home as far as possible, and it's in line with the vision. But we do need to obviously monitor this, you know, during this difficult time in terms of the way that this could change and turn as the year progresses. The other area to note is the performance data for non-elective admissions. And there has been some progress there because of the initiatives and, you know, which is showing in our performance. So some of the post-hospital discharge supports for dementia and medicines and some of the practical things with the Red Cross have made significant differences that have contributed to the good performance in this area. I won't go through all of the areas because actually some of them have already come up in previous updates. But I will just mention the enhanced primary support to care homes, which Nikki alluded to. And I think there's been some very good uptake from our care homes. 33 care homes in Bedford have taken part in the Drinkwell Hydration Project, and the Hydration Champions being responsible for promoting and leading the initiatives, as we know that not only the UTIs, but the falls greatly reduce as we start to see some of these initiatives play out. So it's good to actually be able to see some of the interaction between the projects that are being brought into place and during the time of COVID actually still continuing. I think it's really positive. Secure mail and the IT, just to touch on, Bedford has been particularly positive in terms of how our care services have picked up the national devices. This has obviously been very, very beneficial in terms of residents and connectivity with GP practices, but it's also enhanced some of the wider communication issues between residents and their loved ones. It's also enabled another facet on top of what the care home, for example, would already have. And the digital monitoring, just to mention, is another area where 9 Bedford care homes have enabled care homes to generate early warning scores and some of the really important preventative work that can happen to prevent admissions and to support local residents, you know, to remain as well as possible in their care home. That's really just a whiff. There's lots, but actually they're just a focus. So I hope that was helpful.
Thanks very much. Any questions? Any comments? No comments? No? Happy to note the report?
Happy.
Okay.
Content.
Thank you very much. Thank you very much for the report, Kate. If we can move on to the Health and Wellbeing Programme, which has been circulated. Has anybody got anything to add to that? I think it's a full programme. We've added a few things to that work programme during the meeting. As I say, each meeting, that if there are things you think we need to discuss, please do email them to Alison and we'll look to see if we can schedule them in. That would be really great. Can we note that? Is that agreed? I think I'm going to add a 12A in, just a geography lesson. That I would do wish we could actually refer to Bedfordshire if it's good enough in terms of cartographers, the Lord Lieutenant, the High Sheriff, the police, the Fire and Rescue Service. I think that maybe health should comply with the geography of the rest of us, though. Bedfordshire refers to the whole county. There is only to say Bedfordshire and Luton because Luton is part of the largest town in the county, and I'm very proud to be mayor of the county town, though not the largest town. And in our next meeting, I think there's a confusion between what is Bedfordshire and what is Central Beds. And our name is Bedford Borough. I do have aspirations to be Bedfordshire Borough, but that is probably a takeover too far for myself. But I really do think that if everybody else does that, we shouldn't necessarily be, in terms of wanting to integrate, we should have a common name and a common geography. And I'd be grateful if others would consider that in a serious manner. That's grateful. That was the chair's prerogative. It may be the only thing I ever achieved to get health to understand how cartographers work. Happy to share many maps going back about 1,000 years to show you what the boundaries are. The next meeting of the board, normal meeting, will be held on the 10th of March, which I think means that this will be Patricia's last meeting. Leaving to go to a county that understands its boundary up in the West Midlands, and I failed to get her to understand the boundaries. So you'll have to put up with me less saying about this, but I'm sure up in Staffordshire, isn't it? You're going that you enjoy yourself. And having just been away for a few days, there's a lovely county, and I hope you enjoy working there, going back closer to the Welsh borders. But thank you for all the work you've done, Patricia, during your time here, and wish you all the best for the future. So thank you very much.
Thank you, Dave. That I really appreciate that. Thank you for your kind words.
Thank you. Thank you very much. Thank you all very much for the meeting. I think 12 minutes early, give you time to get a cup of tea. Nikki. Yes.
Mr. Chair, can I put my expectation? So I have the answer to your question.
Thank you.
So it is 7 days. So as of Friday, it was the recommendation was to have the flu first. So I think our party line is encourage anyone to have the flu vaccination. Don't not have the flu thinking that you might not be able to have your COVID. So have the flu. And at the moment it's 7 days. And as I've said previously, things do change.
Indeed,
so that is true as today. And if it changes with the support of Jane, my colleague, we will make sure that communication is cascaded.
Thank you. Can we therefore try and get as many people, as many care workers knowing where they can get the vaccine as quickly as possible? So hopefully they can have it before the end of next week and then have a chance to have the COVID-19 not long after that. I'm sure we'll share that, Kate, with the care workers as quickly as we can. Thank you very much. Absolutely. Thank you all for your attendance. See you at the next meeting. Some of you in about 41 minutes. Thank you all very much.